Welcome to Health Professional Radio. My name is Patrick Reyes, and on today's show we are joined by Dr. Shobhan Manoharan. He's the director at Brisbane Skin and also a senior clinical lecturer at the University of Queensland and Griffith University. Welcome to the show, Shobhan.
Thank you, Patrick. Nice to be here.
So, can you tell us a little bit more about yourself?
Patrick, I'm a laser and cosmetic dermatologist in private practice in Brisbane. I've started my life as a general dermatologist, but over the last few years I've mainly concentrated on aesthetic and laser procedural dermatology. I have two private practice clinics. One's known as Brisbane Skin. It's in the heart of the city over in Newstead, and a large centre known as Westside Dermatology. And we also have a range of subspecialty clinics, including the Psoriasis Institute, Sweat-Free Clinics, and my Skin Cancer Center. So we do have a good range of dermatology services that I'm involved in. I have a personal special interest in the treatment of acne and acne scarring. Acne scar treatment in particular is a real passion for me. Rejuvenation and photoaging is a concern that I deal with regularly as well. I also have an interest in treating pigmentation, and about a third of my work is in regards to the diagnosis and medical and surgical management of skin cancer.
I see, and I have taken a look at the website of Brisbane Skin, and you guys have a wide array of treatments and services. What would you say are the common treatments that are provided to patients?
We are a full-service dermatology center, so we treat everything from, even though I don't do the inflammatory skin conditions so much myself, but my colleagues here are involved in conditions like eczema and psoriasis, and I deal with that on a daily basis. I deal with a lot of the aesthetic pigmentation and rejuvenation side of skin and skin management. Very popular services with us range from very low downtime procedures, no downtime procedures like injectables and chemical peels, moderate level treatments like Fraxel laser, for instance. We're the biggest provider, most experienced provider of Fraxel in the country because it's a very effective treatment and with sort of a 3 to 5 day downtime, and all the way up to very heavy laser procedures for the appropriate patient. So I do heavy facial resurfacing with erbium and CO2 ablative lasers. This is for patients who have very bad acne scarring, patients who have severe burn scars, and for people who have who require it for rejuvenation purposes as well. I describe it as a laser facelift. So it's a varied clinic. It's a full range of services, and that gives you a little bit of an idea on services that are quite popular with our patients.
So speaking about treatment for acne, another reason you're actually here on Health Professional Radio is to talk about a new acne treatment that has made it to Australia. Can you tell us more about it? Absolutely.
Now, it's very exciting, it's very interesting, and very new technology. It's known as Kleresca. It has been available overseas in Canada, and certainly there's trials over in Europe with a paper about to be published in the International Journal of Dermatology. But just a few months ago, Kleresca has become available in very selected clinics, selected specialist clinics here in Australia. So my clinics, Westside Dermatology and Brisbane Skin, have exclusive rights to Kleresca in Queensland at the moment. Certainly we have been having some very interesting, very exciting results with this. And basically it's a therapy which utilizes a wavelength of LED light, with an application of a photoconverting gel on the patient, and over a 9-minute period illuminates the area of concern. So be it the face or the chest or back. Treatments are repeated twice a week, and they're done for generally done for a cycle of 6 weeks. giving the patient 12 treatments. And we've had some very interesting and very exciting results with improvements over that duration of time. What we're also becoming aware of, and these studies I look forward to these studies being released in the International Journal of Dermatology, but patients have been having some ongoing improvement with this 6 months into treatment as well. So after the 12-week treatment cycle, they've had ongoing improvements. So that's certainly something that's interesting and exciting. From our perspective, it certainly suits patients who are not looking for pharmacological therapies or are unsuitable for medications, either oral or topical, or are pregnant, breastfeeding, for instance, and they're not appropriate for a lot of the typical anti-acne medications. This sits very nicely alongside some of our other treatment options that we offer as well. These include treatments such as chemical peels and other forms of phototherapy. But this is a new form of therapy, of non-pharmacological therapy, that's certainly good place in the treatment of moderate acne.
Oh, that's very exciting news to hear. That is actually getting there's actually improvements in other people's skin or acne. And now, a majority of our listeners are clinicians of one kind or another. What's a message you'd like them to hear from you today?
Look, two things. Obviously, with respect to the new product that's being launched, the Kleresca, certainly consider referring patients on for this. If you have patients who are in the mild to moderate acne spectrum, who would like a non-pharmacological treatment option, or who are not suitable for treatment, I also would like to say that acne is one of the conditions that we have in dermatology that is very treatable and very curable. So please do send patients over for next line treatments, because we can give them very good results and prevent scarring as well. If you do have patients with scarring, obviously send them to us for scar management options also. I'm very much about preventative skincare, so it is getting acne patients early and treating them appropriately early, getting skin cancer patients early, treating them early, and also with even with our rejuvenation patients, treating patients in conservative fashion early in their life, getting them the right skin care. Very minimal, non-invasive treatments will often mean that they're not requiring heavier treatments as they age and get older.
All right, and how can our audience members get more information about Brisbane Skin?
The easiest way to get more information about Brisbane Skin is to go to our website, brisbaneskin.com.au. You're also welcome to come into the practice. We have free consultations with our nurses and therapists here. They're here 6 days a week. There are dermatologists here 5 to 6 days a week as well, that you can have referrals to see us, or you can walk in and book yourself in for dermatology consult. Any questions at all, feel free. There's some very good patient question sections on our website, so a lot of patients just drop us a line with queries and questions that they have, and they're often answered by either myself or one of my other colleagues here.
All right, so again, that website is www.brisbaneskin.com.au. And for our last question, which is a favorite question among health professional radio, what's the biggest misconception about your services that keeps you awake at night?
Not too much keeps me awake at night, but unless the football's on. But I think sometimes there's not enough understanding that dermatologists like myself are really the specialists when it comes to all aspects of skin health, skin care and beauty. Patients will often believe they need to go to a skin cancer clinic to have their skin checked and skin cancer treated, or a cosmetic clinic or a laser clinic to have their aesthetic needs attended to. Sometimes I even get asked if we're real doctors or whether we go through medical school prior to becoming dermatologists. So it's interesting. I think the awareness needs to be placed out there that certainly when it comes to any aspect of skin, cosmetic, medical, surgical. Really, dermatologists are truly the specialists, and we're open to seeing patients, and we're very available to seeing patients. Our waiting lists are, I have a big group of dermatologists that work with me, and therefore the problem that used to face patients of having 6-month waiting list to see a dermatologist is not an issue with our clinic. So most patients can come in to see a dermatologist in our clinic within 1 or 2 weeks.
All right. Well, thank you, Shobhan, for joining us today. It's been a pleasure having you on Health Professional Radio.
It's been an absolute pleasure, Patrick. Thank you for having me.
Thank you. Now, if you've missed my conversation with Dr. Shobhan Manoharan, there's an archive audio file on both YouTube and SoundCloud, or you can also read a transcript of this conversation on our website. Now, all of those resources are available in the Health Professional website at www.hpr.fm. Again, my name is Patrick Reyes, and thank you for listening to Health Professional Radio.